Alright, well, it's summertime, and with summer comes injury. I wanted to talk to you about anti-inflammatories, non-steroidal anti-inflammatories. We all know them as Advil, Aleve, Motrin, ibuprofen, naproxen. Those are the standard over-the-counters. There are actually more than that. There's actually 9 different classes of anti-inflammatories that doctors know about, pharmacists know about, but the way you want to use these things is if you have severe pain, then you gotta see a doc. If it's mild to moderate and you want to turn it around, say it's on Sunday night, you want to be better by Monday, it would probably be wise not to just take the turmeric, the glucosamine, the magnesium, the topicals, but also to do your anti-inflammatories. As far as choosing which one of the 9, I have my favorites. Ibuprofen is okay, but at high dose, when it's supposed to help with inflammation, it also irritates the stomach. So you gotta watch out. That's the biggest side effect with all of the classes, stomach irritation. There are some classes that don't irritate as much. One of them used to be COX-2 inhibitors, Celebex, Spectra. They have been since taken off the market, and somehow Celebex got back on the market, but I'd usually avoid them, especially if they were known to cause heart disease. The other ones that kind of lost their popularity but are still very good, I still use them, are Relifen or Nambumetone, Lodine or Etodolac, and Meloxicam or Mobic. Those 3 have some anti-inflammatory properties, and they also protect the stomach, so you might want to invest in those. It needs a prescription, so you might want to call your doctor and find out. If you don't have a doctor, then you'll have to do the over-the-counters, but the way I usually do these things is I do minimum dose, regular, every day, say ibuprofen 3 times a day, or naproxen, Aleve twice a day. Or in the case of my favorites, I'll list them down, but you do that minimum dosing for about a week. If it doesn't help with the inflammation, you go up maximum dosing for another week. And if it still doesn't help, then you need help in figuring out either another medicine, a muscle relaxer, or figuring out if there's any other skeletal damage. Of the favorite ones that I take, or at least I prescribe, Nambumetone or Etodolac, they're both covered by public aid. They're also covered by most insurances. Low side effect profile. Again, a stomach upset. In the rare case, you can have a little bit of swelling, just like any other anti-inflammatory. If you happen to be taking an aspirin every day because of heart disease or stroke, you can take the anti-inflammatory, but you have to space it out by about an hour to 2 hours. So your aspirin does its trick, does its stuff as far as thinning out the blood. Then as soon as that's absorbed, you take the other one. Otherwise, if you take an anti-inflammatory and an aspirin, again, that's an anti-inflammatory, but it's one for preventing heart disease and stroke, take them together, then you lose the protective effects of that aspirin. So try to space it out. As far as using turmeric, glucosamine, sulfate, magnesium, and an anti-inflammatory together, go for it. I don't think there's any problems with it. Actually, the treatment for, say, motor vehicle accidents or falling off of a bike and having muscle spasm and road rash, anti-inflammatory, muscle relaxer, and then a rescue narcotic medicine just in case. It's always good to have that. Some people would say, I don't like taking narcotics, and that's fine, but you have to maintain good sleep. If you don't have good sleep because you're tossing and turning, then that's going to affect your healing time, and that's when I say it's probably wise to invest in a strong pain medicine, even with the side effects of strong narcotic pain medicines. So that in a nutshell is how to use an anti-inflammatory. Either ask your primary care doc or an orthopedic guy, or you can ask your pharmacist about which one. One of all 9 families, there is one that is safe for people who have kidney disease. It's Clinaril. I don't think that too many primary care doctors remember that one, but that's the only one that you can use safely in kidney disease. Otherwise, they're all about the same. Might just be a shot in the dark as far as trying one that hopefully will work for you. If you have a chronic disease and if there's no time limit, try a bunch of different ones, be on schedule. If it doesn't work, check it off. Don't go back to that one until you find a good one to help you. Taking a steroid, it's okay to take a burst every once in a while, but if you keep on requiring steroid bursts, 5-day bursts of prednisone or the Medrol dose pack, that's going to eventually take away, it's going to make your bones thin. In addition to causing maybe swelling and sometimes a habitual dependence to it, or at least it shuts off your own cortisol production. So not always healthy. If you need it, you need it, but try to avoid that one. And the other thing too, truly, if you have an injury, stay away from dairy. Try to avoid gluten, mostly fruits and vegetables, whole grains that are non-gluten, and healthy fats. I think all those things together will help you heal up as fast as possible. If you can't, then you need the help of a physician to get you back to where you were before.